Hello, this is Dr. Elzik. The topic today is tennis elbow. I've had many patients talk to me about what is tennis elbow and what can be done to treat it. I already have a surgical video online about how to surgically treat tennis elbow, but let me talk to you about all the different ways available as far as treating it. Tennis elbow is a condition that arises from overuse of the muscles that extend the wrist and fingers. And so with wear and tear, with age and overuse, the elbow can become quite painful and inflamed. And so knowing that that's what tennis elbow is, perhaps the most important way to treat it is with modifying your activities. For example, anytime you're lifting something heavy and using your wrist or fingers to hold that heavy item, that's really going to set it off. So anything you can do to limit those kinds of activities, lifting a gallon of milk, or lifting a heavy child, or anything like that is really going to set it off. Or even some of the activities you do in the gym need to be tailored so that you don't aggravate your symptoms. Another thing that can be done is simply in the workplace. For example, we're using the mouse and keyboard, and we're extending our fingers and wrist every time we type on these keyboards and use these mice. But if you were able to get an ergonomic device, that would be most useful to help with some of your symptoms in the elbow. Another thing that many people find very useful is a tennis elbow strap. A tennis elbow strap is a device that simply goes around the elbow just like this, and it's very, very convenient and easy to put on. And when you have it on real tight around the elbow, it puts pressure right where the tendons originate to take off some of the symptoms that you have with overuse of the wrist and fingers. And then something else that can be used in conjunction with a tennis elbow strap is something called a wrist brace. Now this is a custom molded one that is made by a certified hand therapist, but by putting this brace on and limiting the motion you have at the wrist and not being able to move, it's very, very helpful so that you don't aggravate and re-aggravate the injury that has already occurred around your tendon origin. If these devices don't help, then something that can also be useful is something like Aleve or Advil, or perhaps an anti-inflammatory pain cream like Pennsaid or Voltaren Gel, which is an analgesic, and these types of medications can also be very helpful, and this one is very useful in prescription strength. Now, if the medications don't cut it, then the next level of treatment would be a steroid injection, where an injection goes straight into the origin of the tendons and muscles in the elbow, and this essentially acts like very focused and concentrated Aleve directly into the elbow tendons, and this is very, very beneficial, but should only be done by an orthopedic surgeon or upper extremity surgeon who's trained in giving these steroid injections. Now, if none of these treatments have worked out for you, and it's been several months and you still have quite a bit of elbow pain and pain radiating down the forearm as a result of your tennis elbow, then really the only option is surgery. And please see my surgical video online and on YouTube or under my channel, Mark Elzik MD, and it will describe the surgical treatment for this condition, which is quite beneficial for most patients. Thank you for your time.